Which patients should get cancer rehab? If you haven't yet, you will most likely at some point be asked this question. So what is a good response? I'm cancer rehab specialist, Dr. Leslie Waltke. Welcome to the Tip Jar. Considering surgery, chemotherapy, and radiation all may cause musculoskeletal, cardiopulmonary, integumentary, and functional deficits, the simple answer is anyone who's had or will have surgery, anyone who's had or will have chemotherapy, and anyone who's had or will have radiation. But here's the tricky part. In most standard non-cancer rehabilitation scenarios, patients are coming to you because they have an injury or deficit. So they actually have something that needs to be fixed. But in the realm of cancer rehab, not everyone undergoing treatment for cancer will develop deficits, or at least not develop deficits right away. So how then is this best managed? A really good cue comes from our cancer care colleagues. When a person is diagnosed with cancer, they typically get a surgical oncology, medical oncology, and radiation oncology consult. After the consult, each one of those MDs individually determines if the patient will benefit from their particular service line. For example, everyone sent to a medical oncologist isn't automatically going to get chemotherapy. It is the job of the medical oncologist to determine if the patient needs chemotherapy or not, and if so, what kind and how much. Similar with radiation oncology. He or she will determine if the patient needs radiation or not, and if so, what kind and how much. In cancer rehab, I strongly suggest the same pathway. All patients exposed to surgery, chemotherapy, and radiation should get access to a cancer rehab consult. And at that consult, you examine, assess, and evaluate your findings, and then determine if the patient needs rehabilitation, and if so, how much, how often, and when. So in the cancer rehab world, patients are not necessarily coming to you for rehab, they're coming to you for a consult to see if they need rehab. Oncology doctors, nurses, and patients often mischaracterize cancer rehab as something like cardiac rehab, where the patient will be pipelined automatically into a cookie cutter of multiple visits per week for multiple weeks. And I believe this is a significant barrier to referrals and patient buy-in. So our answer to what patients need cancer rehab is, we don't know. There is no way to know if the patient needs rehab or not unless you examine them, their history, and their cancer medical management plan. Only after your consult can you most accurately make that determination. But the answer to the question, which patients need a cancer rehab consult, is again anyone who's had or will have surgery, anyone who's had or will have chemotherapy, and anyone who's had or will have radiation. So pretty much everyone. Thanks for joining me. I'm Dr. Leslie Waltke. Have a great day in the clinic.